Welcome to Lane Chiropractic. I'm Dr. Lane. We are joined today by Travis Withrow. Today we will be going over a few protocols in our office that we see daily. Travis is complaining of elbow and wrist pain today, so we are going to do a few series of tests to determine what's causing those problems. Let's go ahead and have you lay on your back, Travis. As a chiropractor, I deal with the spine primarily and the nervous system, so we're going to zero in on certain tests. We're going to isolate certain muscles to determine where the cause is coming from. We know that the effect is pain in the elbow, in the wrist. So let's first start with a simple manual muscle strength test. It's functional neurology. If the nervous system isn't working correctly, the muscles will not be strong. You will not have the flexibility, the balance, or the strength. The body heals itself from above down and inside out. That's just the way God designed it. So if he has a problem here from the outside, we know that it's coming from the inside, and we're going to the inside to find the cause. Hold this and don't let him pull this down. Hold, and Travis is weak here. Hold this one more time. Hold. This is an isolation for the fifth cervical in the neck. If this is out, the brachial plexus, the fifth nerve root is going to be irritated in the nervous system, and the brachial plexus isn't going to work correctly, so all your muscles will be weakened. You will have more prone to injury. Thumb and pinky together, elbow straight, hold, do not let pull those apart, and that's blowing out too. That is for the lower cervicals. Let's check some wrist extensors. Hold that and do not let him pull this, or do not let him push this up. Hold, and he's actually all right there. Hold, good. Flex your wrist down. Let's check his wrist flexors. Hold this, do not let him push this up. Hold, and that's good too. So we know his T1 is going to be fine. Let's go ahead and have you have your arm out to the side. This is checking the latissimus dorsi muscle. Hold this and do not let me push your arm out. Ready? And hold, and that is going to be weak also. Hold. And so we're going to have to strengthen a lot for the shoulder here. First thing we would do is we would come into the spine because the power is in the panel. If we go back and flip the switch here where the nervous system isn't working, we know that if we turn the nerve back on, the nerve going down the arm will strengthen the muscles, and then the body can heal itself. So once again, we would start at the fifth cervical, and a slight adjustment by a chiropractor. Good. Hold that now, and don't pull your arm down. Hold, and now it's strong. Hold. So now he's going to have more strength in his arm. His elbow is not going to be compensating for all the integrity that was lost. Do this right here. Elbows hold, and that's strong also. That was a manual adjustment. Some people prefer a instrument adjustment. Let's have you sit up here, just straddle the table. I use the Erconia adjuster. I've got the cervical attachment on for this. What I want to do here is to stimulate the mechanoreceptors in the neck, and I'm going to slightly tap the bones back into place here. Now you remember he was at C5, lower cervicals. I did not do tests for the upper cervicals yet. So that is an instrument adjustment. A lot of people prefer that. Certain patients with osteoporosis, it works really good with children. We could have adjusted him like this and this only, and he still would have gotten strong, which is amazing. So now that we've adjusted Travis manually in with the instrument, we're going to go back through and check the muscles. I have not checked every muscle in every segment of his spine. If you remember, I haven't even checked his upper cervicals yet. So hold this up. This is a test for the straightest anterior on the posterior aspect of his spine and shoulder. Hold this. Do not let him push this down. Hold. And he's still weak there. So a lot of times I see with patients, I can do an adjustment from head to toe and the patient is still weak, still in pain, still having the same problems. And I don't want to just send him home and say, come back tomorrow and we'll adjust you again, because there's still a lot left over. What I do now is I grab my vibropercussor, which breaks up fascia restrictions, because if you've had an injury to an area or the problem's been there for a while, you're going to have some atrophy in muscles. The muscles haven't been working like they should. We need to reboot the computer, which we did that through the adjustment. Now we need to reboot the muscles. I'm going to set this on the fascia restriction level setting 5. Setting 5, coming back here. Very relaxing. Most people think it's a massager, but it actually sends percussion waves to break up the fascia restrictions. We're going to leave it here for about a minute And after that, we will re-perform the test to see if that strengthened it. It's been about a minute. Let's have you hold this up. And do not only push this down, hold. And now we're super strong. I tell my patients they could be sore because they're going to be using muscles they haven't used in a while, so it's like starting a new workout program. Next, we're going to do ART, active release technique. For more information on that, please go to my website and visit it. We're going to start here. Let's have you hold your head back like this. Go ahead and tuck your chin to your chest and look down to your left. Good. You feel that? Mm-hmm. Good. Same thing. Look up for me. Relax this arm. Relax this. Relax this. Relax your elbow here. Good. Bring this across. Tuck your chin down. Good. Your chest.